Well, hello, welcome everybody to the JCU GP Training presentation and promotion around joining general practice training for 2021. We're delighted to be able to have this opportunity to meet with you and chat with you. And first of all, I just want to pay my respects to the Aboriginal people right across our vast lands. Obviously, we're connecting in from all parts of Australia. And we pay our respects to those people and elders past, present and emerging and future. So first of all, GP training, it's exciting. You know, I've been a GP for over 30 years and every day is different and every day has something that really I find interesting, challenging, and of course it's a very people orientated profession. And so particularly I want to present to you that general practice is exciting. There's opportunity to explore, to have adventures, to develop a whole range of skills and competencies, but most importantly, to really connect and make an impact with your community. And obviously, JCU GP training, we cover the vast part of Queensland, over 90% of the state, what is called the northern western part of Queensland. And so you can have the opportunity to train in a range of locations across regional and rural and remote northern Queensland. Let's look at the next slide. So that gives you appreciation of the different regions. JCU has a unique model. Our model of training is of a regionally distributed model where we have support training through various rural training nodes in each of those settings that you can see there, which does mean that we can be quite connected with those local communities, but also quite well aligned and engaged with the local hospital and health services. It really is a diverse landscape and it's something that we encourage you to embrace. Next slide. So why choose general practice? Everyone's motivation may be different. Here's a few ideas that you can read of there. But I think most of all, the thing that really attracts me is that I enjoy hearing people's stories and having that opportunity to be involved in holistic patient care. Now, whether that's through a traditional cradle to grave approach or whether it's a holistic approach in more of getting to know people and then being able to walk with them as part of their journey, each doctor creates their own style of practice. And in that sense, there's a great degree of flexibility and adaptability possible where you can have control over your working arrangements. Next slide. So the federal government, Commonwealth Government of Australia, has been funding the Australian General Practice Training Program for about 20 years now, and there are 1,500 training places across Australia. But we work very closely. This is sort of governed and overseen by both colleges, the Royal Australian College of General Practitioners and Australian College of Rural and Remote Medicine, or ACRM. And those colleges have that degree of oversight. They provide very clear training requirements, standards of training, accreditation, curriculum around general practice and rural and remote medicine. And then they ask that each regional training organisation like JCU GP Training really deliver that and operationalise it over those years that you're involved in your postgraduate specialist GP training. Next slide. And so you see there are across Australia 11 training regions, but 9 RTOs. In New South Wales, the one RTO is divided into 3 regions. But in Queensland, there are 2 regional training, one in the southeast corner and GPTQ, and one across the 90% of Queensland of JCU GP training. At the end of the day, whether you follow the ACRM training or the RAC GP training, you end up with a fellowship. if you successfully complete your training and your summative assessments. And that fellowship of either college is recognised by the Australian government and by the Australian Medical Board as a postgraduate specialty qualification, which then means that you're entitled to have access to Medicare Australia, for instance, in terms of your billings. But they are also recognised internationally and are well regarded, both colleges throughout the world. Next slide. So of the Live on Training, you need to carefully consider that when you join the National Australian General Practice Training Program, you'll be asked to join which of the regional training organisations is the one that you would seek to be involved with. Next slide. So I've mentioned JCU GP Training is one of the 9 regional training organisations. Our role is operationalising and delivering them. Basically, we're very keen on supporting registrars and helping them train and progress through those 3 or 4 years that they're involved in training, providing additional and specialised skill opportunities to be developed, whether it be in mental health or in paediatrics or obstetrics or anaesthetics. There's a whole range of possibilities and even more extended skills training possibilities in musculoskeletal medicine or skin cancer management, or for instance. We also are very involved because we work closely with the hospitals and health services and the communities where general practice occurs, involved in the placement of registrars and finding a placement that's suitable for you and your training requirements and intentions. We also provide a whole range of educational and training opportunities, whether they be face-to-face workshops, simulation training, online, case-based learning, and all of that is backed up within each of the training nodes with local teams of education and professional and medical educator staff to help you on this journey. We want to work very closely with you in these next years to come. Next slide. So if we go to the next slide, you'll see I mentioned that you can choose either whether you follow the ACRM training pathway and end up with a FACRM, or whether you follow the RACGP training pathway and end up with a FRACGP. Now, both of those, if we go to the next slide, you'll see they'll compare those two, and you'll see ultimately that the FRACGP and FACRM training have a lot of similarities, but there are some differences. The ACRM training is a 4-year training program, of which 1 year is an advanced specialised training in one of 10 different areas: obstetrics, anaesthetics, mental health, paediatrics, for instance. The RACGP training is 3 years, but there is an option for those who want to do an additional year, what's called an advanced rural skills training year, and with some extra education around that year, also then get a second fellowship called the FARGP. But really, in many ways, both colleges emphasise the importance of having some core hospital and clinical training occurring, where you cover some mandatory areas like emergency medicine and paediatrics, for instance. But then there is an emphasis on, obviously, learning your art and mastering your art in general practice by working and living and training in a community and working in a primary healthcare general practice facility over 18 months to 2 years. Next. And then it's generally in the end of that 3rd year that you would think about sitting your summative fellowship exams. Next slide. So I mentioned in that first year of training is there are various mandatory hospital rotations, which are slightly different with ACRM and RACGP, as you can see listed there. And also for some of you perhaps who have been working for 3, 4, I've had registrars join after they've been working for 20 years because it is seen that this Australian General Practice Training Program is the most supported way to help you attain fellowship in terms of education and specific training support. So those people who've got some years under, I think, can apply for something called recognition of prior learning, and you may get a credit for this mandatory hospital year, for instance. Anything else? Can I also say, please feel free to ask questions through the chat room. In the bottom of your bottom corner of your screen, you'll see a little raise a hand and a Q&A icon, and please use these questions to ask as we go along, or we can do questions and answers at the end of the session. Next slide. So we've mentioned about that year in hospital, which is generally a PGY2 year or above. So you've done your internship year, and then your PGY2 year is that core hospital, core clinical training year or above. And then you go into your first year of general practice. In a typical week, maybe that we'd expect that you'd be working in the practice and would be seen to be part of the team of that practice. So whatever that practice is involved with, you're involved with, which obviously means consulting with patients, with your own consulting room, but working as part of the team in the general practice, which might be with nurses, the receptionists, allied health, or others. In terms of through that first week, you'll also have time with your supervisor or part of the clinical teaching team in the practice, where it might be some tutorials, it might be what we call teaching on the run, which is sort of where I've just seen this patient with a problem that you have no idea what to do with, and you talk it over with a more experienced doctor. And then, if the practice is involved in on-call or weekend work, you would expect to be involved with that in an equal way as other people in the training.
Laurie,
yes, please, Paula, is the question there?
Interrupt you. There's a very common question here is how much pediatrics do you need? So I'm happy to answer that, or if you want to answer that for RACGP training, Tahira, is that right? So for RACGP training, you can do it in several ways. You can do it through 2 emergency rotations, or you can actually do a pediatric term, a full pediatric term. So that there's different ways to do it and different combinations of ways to do it as well. So if you haven't actually got a full pediatric term, you can count some of your emergency time for that. And then ACRM, Laurie, I'll hand over to you because ACRM have got specific requirements as well.
Yeah, ACRM also have some mandatory, what they're looking for is competencies in paediatrics, okay? So it might not necessarily much as time in terms of weeks, but can you show those competencies have been developed? So it may be that you've been working in an emergency department that sees a lot of paediatric population. Well, you can use that scope of practice as a way to show how those competencies have been developed. And each of the colleges will have specific details around that. The other question is that, yes, if you've already been working for many years, you can apply for recognition of prior learning. So if you've been a doctor for many years, you can apply for recognition of prior learning. And each college also has some rules around that. But certainly someone who's perhaps been working in the hospital system for 3 or 4 years often has done a variety of rotations in that hospital. And it's important to just be able to look back and see how that can be attributed to each of those mandatory rotations or mandatory competencies in each of the clinical domains that the colleges are looking for.
And yes, if
there's
you're...
a really...
Yeah, and if you're a UK doctor too, yes, some of that can be counted, though it's a little bit trickier if you're a UK doctor. But it's still possible, and particularly both colleges would look at that as well. Sorry, Laurie, I interrupted you there.
No, they normally do look at what is the Australian experience in terms of the time, but in terms of if you've had many years working in the UK, for instance, then you can look at those competencies too. We encourage interns to apply to Australian General Practice Training, okay, and this year is no different. Even though the Australian Medical Council have said that they will be accepting a minimum of 40 weeks instead of the 52 weeks for you to get your full general registration. And, you know, the Australian Medical Board have also said that they will waive the requirement to have general surgery or general medicine or emergency for you to progress to general registration. So the key thing is that you can still apply. You will be eligible to apply, even though as an intern for this year. I wouldn't call that an exemption. It just means you're still eligible. But at the end of the day, we're going to then, in the years ahead, have to work out how you can attain those competencies that are seen to be important around general surgery. Okay, next slide. Good questions. Keep them running. Okay, so in terms of selection, there's a national selection process, and that's where you're applying to Australian General Practice Training, and part of that is that they'll assess your eligibility around being an Australian citizen, permanent resident, your eligibility in terms of you have full, or you will have full general registration as of the beginning of next year, and obviously a few other things that each college looks at in terms of, well, visa requirements is another one. What I can say for JCU GP Training is that we won't be accepting 457 visas this year, and so we're asking that registrars are permanent residents or citizens to join at the time of joining. And then both colleges will look for you to have slightly different elements in that national selection. ACRM asks that you submit some referees, and then we'll do a sort of mini mental interview with you as an MMI. And RACGP will be asking you to do an online, what's called CAT exam, and then have an interview with your preferred RTO. After the national selection interview process, then that's when offers are made through you've been successful in your national selection, and then you've been made an offer by a regional training organisation. It's at that point of then accepting your offer that then you can start feeling quite confident that you're assured of what you'll be doing next year. We've got some other questions there, Paula. Is there anything there that we need to pick up on?
Yes, no, I think I answered them. I think we answered the one about general registration. I think if you can get your rotations, I think that's a good thing. But often hospitals in this pandemic are being their rotations are being frozen, and there is a reason for that. I think that's being revisited as time goes on, but people are bending over backwards to be incredibly flexible this year. Obviously, if you haven't done any surgery, then whenever you go to emergency, your emergency rotation, it would be really useful to, be especially interested in surgery patients or post-op care or, anything like that. So just be aware that just because you haven't done your 3-month surgery, you'll still need to know that, and just maybe do some extra learning in that, some CPD, extra you know, learning so that you're aware of where your gaps in your knowledge is. You did surgery 15 years ago in the UK. All right, Amy. So you sound like you've got very specific questions. So it might be worthwhile maybe just emailing us maybe after all of this. The RACGP and ACRM don't really look at anything prior to 10 years because they say that's sort of, you know, outside recency, but there are, you know, there's always solutions to everything. You know, if you've been practicing medicine recently, you've been doing general practice, or you've been doing emergency or whatever, you will still come in contact with surgery patients. So even though it's going to be a little bit more pain, all of these things are very solvable. There's always a solution. So that, as Laurie says, you can prove your competency. Yes, I do know how to look after somebody post-op. Yes, I do know how to assess somebody an acute abdomen. You know, so there's always a solution. Yeah, but Laurie and I are very happy to answer, you know, your specific questions afterwards. Yep. And you can hear by my accent that I'm from the UK as well, Amy. So that is all good.
We love UK people, particularly the Irish. Next slide. So, yeah, these multiple mini interviews, they're called, you know, maybe you call it speed dating, I don't know, but basically each of these are where you are quickly asked to, you have a scenario or a statement on the door, and then you're given an opportunity to respond to that. I think the key thing is that how can you prepare for these interviews? I think the best way to prepare it is to be true to yourself. You know, we want you to be genuine and true and honest with yourself. Don't say things that you don't mean, okay? In terms of, it's important to have a good understanding of what general practice is, or for ACRM, what rural practice means, what rural generalist medicine means. And each of their websites has some very good information around that. As you go onto the websites, you can also see RACGP talks about their domains of general practice, or ACRM talk about their key elements, their 8 key elements. Both of them pretty much say many of the same things, which is it's more than just being a clinician, being a GP. You're often also a leader. You're often also a manager. You're also often a collaborator. You're often a teacher. You're often a researcher. So there's a lot of other elements in terms of being a GP. But I think the important thing is that we would really encourage you to be yourself, okay, when you're thinking about these multiple mini interviews. And this year, I think they'll be done by video conference due to COVID. Certainly ACRM have indicated that, and RACGP will do shortly, I believe. Next slide. So what are we looking for? Well, that's probably what I was just talking about, really. You know, what makes a good, each of you would have an idea of what makes a good GP, what makes a good doctor. Invariably, the literature talks about these elements, about not only being clinically competent, but also being a good communicator, able to manage the ambiguous, to be an advocate for your patients and the health systems. So these are some of the important areas, but there invariably may also be other areas like a degree of resilience or conflict management, but it's an exciting time. And I think one thing that COVID is showing is that GPs right across Australia are actually at the front line of managing the COVID crisis. They're the ones who are dealing with the vast majority of issues. It's not occurring in intensive cares or emergency departments. It's occurring in GP surgeries right across the land. And so JCU GP Training, you know, our whole mission statement, the whole reason we exist is to train doctors with the skills to make a positive difference in their community, whether it be regional, rural, remote, Aboriginal, or an underserved community, or beyond. Whatever that community is, we want to train you to make a difference there. Next slide. I've mentioned the curriculum. The curriculum in general practice is very broad. And so during your training, part of your placements is we make sure you get a broad scope of practice. Next slide. And this is the reason why, is that, you know, and shows the diversity of general practice. You know, 42% of GP visits involve a clinical or procedural treatment. I think it's really important that we are also the gatekeeper, if you like, of the primary healthcare system that enables then the access of the patient. And that's where having a degree of advocacy is so important. Next slide. And so it gives you, here just gives you an example of that diversity. You know, this is the 30 most frequently managed problems in general practice, based out of the Beach study that was done over 30 years or more. And you can see the huge range there. And so interestingly, I think in this time of COVID, viral disease, 0.07% of the problems, is that you have to remember that far more people are going to die this year from other problems that are normally managed and lack of access to a GP rather than probably by COVID. So it is vitally important that GPs keep providing those services across Australia as that front line in management. Now, there's a really good question around cost, okay? Definitely both colleges. First of all, I'm going to say Australian General Practice Training is well supported by the federal government, okay? It's actually the only specialist training program that is funded by the government. In saying that, there are individual costs to the registrar. So applying for training, there is a cost involved, and look at the relevant websites on AGPT or ACRM or RECGP for the exact costs. And then through your training, there's no cost for training per se, but there are costs to be a member of each college. So you must enroll and be a member of each college, makes sense, from the start of your training. And then there are costs in doing your summative assessments, whether it be a written exam or a sort of OSCE type exam. Okay, so that's one reason.
Can I just add something in there, Laurie? You know, if you're going to do surgical training or medical training, it's certainly not subsidized to the same degree as what general practice is. So if you join the training program, you essentially get a scholarship from ACRM or RACGP. So they will subsidize your placements. They will give you continuing professional development money, which doesn't happen in surgery or medicine. You know, you'll get workshops paid for you and things like that. So it's worthwhile just knowing that you will not have the cost that other specialties have during their training, essentially. Yeah.
Now there is. It's probably fair to say that you could do both colleges training, and both ACRM and RECGP.
Go do it. Why put yourself through it?
I've got a fellowship of both, and I want to say that both colleges have a good, really wonderful. They've got a unique identity. They both provide slightly different things with a slightly different focus. And I have the huge advantages that I can jump from one to the other depending on what I feel like in terms of my professional development. But that doesn't mean that you have to do both from the beginning. And I would certainly, I think the cost of being involved in both is probably something that you need to be mindful of. It does, you would need to be very well organised. Because there are two different training requirements, two different lots of paperwork, two different lots of curriculum to follow, and two different lots of exams, just very simply. So it is possible, but it's not something that you should go into lightheartedly, because would take a lot of extra work from you to make it happen in that period of time, in the 4-year period of time. Okay,
And
it's certainly
in long term, you have to belong to your college all your life. So your college fees are, you know, over $1,000, and you're up for that times two if you decide to be, you know, dual fellow. You know, as Laurie says, it's worth considering, and it certainly, you know, may carry you where you want to be in 5 or 10 years, but it's certainly not necessary. Join one college would be what I would advise most people. If you're incredibly organized and very driven, then by all means apply to both.
certainly. Dr. Amy said, you know, the difference, there really is a lot of similarity. There's more similarities between RACGP and ACRM than there are differences. I think certainly, and if you have a FACRM, doesn't mean that you can't work in a Sydney in the future. Okay, both fellowships have the equal weighting and recognition throughout Australia. It means you can be an independent practitioner anywhere, and in fact, it's recognised around the world. So, with the appropriate accreditation, it is very well regarded internationally. So, and RACGP also have a rural training sort of arm and focus, if that's what you want to get involved with. So I'll just encourage you to look at both colleges, look at both websites, and work out the one which seems to be better suited to what you are looking to do, the type of practice that you are interested in that would help prepare you best for that way. All right.
Oh,
so,
sorry, Amy, I'm not sure, do both allow you to do general medicine internally? I'm not really sure what that means. General practice, absolutely. You can, as Laurie's saying, you can do general practice, you know, all throughout Australia. Both qualify you to be an unsupervised general practitioner, able to practice general practice anywhere in Australia. So to work in the hospital as a physician, no, to work in Queensland Health Hospital as a physician, you need to do general medicine training. If you want to work in a rural hospital, then you can do RAs as a special interest in general medicine and work in a hospital. Then you can do RACGP and do a FAR GP with a year of internal medicine, or you can do your ACRM with a year of internal medicine as well. You'll still get your ACRM degree, you'll still get your RACGP degree with a FAR GP, and that will give you an additional qualification, but it doesn't mean that you'll be a Queensland Health specialist in a regional hospital. It will be a smaller rural hospital where you'll be the GP with rights of admission, and you have your special interest advanced training in general medicine. Yes. Okay, Amy. Yeah, both you're able to do that. And both it would be a 4-year training course. So you would be able to RPL 1 year, and then with ACRM, you would do your advanced skills in internal medicine. In RACGP, you would do that, and you can do it either at the beginning or at the end of your general practice. Yes, only 1 year maximum. Yes, that's all. Yeah, and you know, some people get very depressed about that it's only 1 year. This is a very, very short training course. It's only 3 years. If you're doing RACGP, then you RPL 1 year, it's down to 2 years. You've got 2 years for you to learn your craft, to pass your exams, for you to be a specialist. That's an incredibly short period of time. So by all means, people would like to RPL more, but it's not allowed by both colleges. And there is a reason for that, is because it's a huge curriculum and it's a huge amount of study while you're working as well, you know. And what difference does it make? You're working as a GP anyway, you know. So I again, I'm happy to talk to you about that, Amy. I can see perhaps where you're coming from, because it sounds like, you know, you've been out, you know, very, very many years. Yeah. Okay.
So folks, that brings us to the end of our formal presentation, but obviously we're really keen to talk with you, to hear your questions, and each of you might have individual situations, so certainly you can contact us and we can talk more. Okay. Are there any questions from the group?
So Tahir is asking, when can I start to apply for GP training this year? So
now.
Yeah, no, exactly.
You can start now. I can tell you there are 1,500 training places, and I've been speaking to both colleges in the last couple of days, and I think they have already received, I wrote it down, I think they've already received something like 500 applicants already. Okay, so I would suggest you should be starting to look at that those selection now, and getting your paperwork started. So Michael's given a very individual situation sort of thing there. Where do you find out more? I'd suggest come and talk to us about it, and we can help answer that question. The short answer is that once you have your fellowship, you don't have any limitation of where you can work, but the limitation is placed on depending whether you have any visa requirements, for instance, okay? Or whether you're under rural bonding, for instance, through med school. For those people, you might not, if you're waiting for your permanent residency, you can still apply now, and with view that your permanent residency may be in place by that point in time at the start of next year. All right. But what JCU have said is that we won't be, in the past, we've supported visa applications, 457 visas, for instance, but we won't be doing that for next year. All right. And yes, Sunshine Coast is popular. Essentially, it's general pathway registrars. There are very few rural training locations on the Sunshine Coast. Okay. So I think it's important that, and the one thing I would say is that our expectation is that registrars will live, work and train in their training nodes in their communities. We do not support commuting from capital cities. Can I put it that way? All right. What's the likelihood of receiving one's preferred RTO? I guess it depends purely on the numbers that have applied, and ultimately from the national selection, there is a degree of merit-based, and the higher merit ones are the ones who get their earlier preferences. But that doesn't mean that if you're lower place that you won't get, one of your preferences. I think often you're asked a preference across Australia, okay? And it applies to RACGP and ACRM as well, okay? One of the things that you have a preferred training region, if you like, or a rural node, you mentioned, say, central. We strongly encourage and support that connectivity to rural. So if someone has family living in the in Charters Towers or Ayr or something like that out of Townsville, well then we're very interested in hearing about that, because we think that's helpful. We think that's an important consideration, and we would be quite, as much as we can, be supportive of trying to make that happen.
I'd just like to say, if you want to apply to Central Queensland, if you want to apply to JCU and you're successful, then I would think that would be, that would be certainly very, very possible. The Central Queensland is very possible. If you apply to the Sunshine Coast, then I would have a healthy dose of expectation that I may not be able to get the Sunshine Coast. Okay. It's, and please have no expectation that we would place you on the Sunshine Coast if you want to commute from Brisbane. That is a recipe for disaster. People really, really don't do well commuting. And we know that time and time again, they're separated from their families and they try to commute long distances. And it makes for miserable registrars, miserable practices, and miserable families. So, you know, if you wanted to do that, and of course, I completely agree, Central Queensland's way better than the Sunshine Coast. Far better coffee shops as well.
Beautiful spot. And and look, if you go on our website, you'll see some videos around each of the rural training nodes. So for those of you who perhaps you know, don't necessarily know certain areas, that's fine. Just get on the JCU GP website and have a look at the various various videos around those areas and some of the experiences of the registrars who are doing or have done their training there. And so in that sense, answering Renee's question, no, I don't think you have to be working in the Queensland hospital system prior to starting GP training at all, because you know, ultimately it's about working across the community. And once you're in the community, then if that's something you want to do a blended placement, well, then that can be organised. In terms of maternity leave, GP training, Australian General Practice Training has very supportive maternity leave and other leave provisions, okay? So that is, you know, totally supported, whether you're with ACRM training or RACGP training. And then the specifics about, does paediatric intensive care count towards paediatric term? Definitely it counts towards it, all right, but we just have to look at the degree of scope of practice, so to see whether that would cover, you know, the wider things. You know, developmental delay, for instance, would be a competency around in paediatrics which may not have been covered. But there are other ways that over the 3 or 4 years of training that you can be supported to develop those paediatric competencies if you don't have it up front. You can definitely apply while your permanent residency is in an application sort of stage, but you know, ultimately you have to. You would need to be, for JCU GP, you would need to be a permanent resident or have that sorted before you start. Okay. Now, have we covered all the other questions?
Just flicking back through, Laurie, is there anybody has anything that maybe I've missed or maybe I haven't seen that maybe would like to ask it again, just in case I've missed something? Can you choose to do part-time? Of course you can choose to do part-time, but it's not a good idea to do very, very little part-time. If you're only wanting to do 1 or 2 days a week, then that often leaves people at a disadvantage coming up to their assessment. So of course you can do part-time. The RACGP and ACRM expects that you will choose to do full-time training. That's their expectation. And if you've got children or if you've got extenuating circumstances that you would like to apply for part-time training, then by all means. We know from experience with people that do very, very little in, you know, just 1 or 2 days a week, that they really struggle. So again, we'd have a talk to you, find out what your circumstances were. Yeah.
And generally, I would suggest part-time. The minimum's probably half-time. Okay, bearing in mind that you're at a point of where you need to be rapidly developing your knowledge, skills, and approaches in general practice. And the RACGP, for instance, say for even someone who's fully fellowed and very experienced, the minimum RACGP really recommend to maintain your skills is 0.3 in general practice. So when you're in an actively learning stage, it makes sense that you need to be 0.5 or more.
So both ACRM and RACGP have got great big sort of banners up on their website about how to apply at the minute. So there's no point in us telling you, you know, you need to do this and this and this, because that's all terribly boring. You just click on RACGP, click on ACRM, and it pops everything up. Everything's right there, ready for you, and you can compare the two application processes. Bear in mind, ACRM's a year longer than RACGP, so have a think about that, how that fits in where you want to be. Do you want to be a rural GP? Would you prefer to be, you know, a regional GP or a suburban GP? And have a little think about what type of assessment you like as well. Do you like continual assessment throughout your training program, or maybe just leave it all to the end? So you've got a whole load of things really to think about. But I think the most important would be, what would I like my life to look like in 5 years' time? Would I like to be working part-time in the hospital and part-time in a rural community? Well, then perhaps ACRM might be the best way to go. However, RACGP and FAR GP is a possibility as well. If you prefer to be working in a city or in a large regional center, then maybe RACGP is the right way to go. But again, you can still do ACRM, and still both of them will still allow you to do that. So that's the incredible greatness about the system, that you can pick and choose which college that you decide to choose with, train with.
So you just have to, for international medical graduates, you just need to check with with Australian General Practice Training about whether there are any restrictions being placed on them, on you. Okay.
Anybody have any other questions? Yeah, I wrote it down. It's, if you just flick back up again, but I'll write it again.
So look at the websites: JCU GP Training, ACRM, RACGP. Paula's putting an email through to you there. Mine's very simple: laurie.macarthur@jcu.edu.au. And on the last slide of the presentation, it had contact numbers for our JCU selection and placement team. So just email jcugp.placements@jcu.edu.au, or ring the number there, 07 5373 4413, and join those happy smiling ladies and journey on into the future.
Oh, that's so funny. Absolutely. They look
okay.
The big helicopter in the background. That's great. Doesn't happen in my practice too often, but anyway.
We'd love to talk to you more and help you on your way. Take care then.
All right. Thanks for joining, everybody. Look forward to meeting you all. Okay. See ya.